Hello again. It's Gina with Rosemary and Thyme, and today I'm going to talk to you about cardiovascular health. This is part one of a two-part series that you can check out in my additional video of part two. So before I get started, I just want to give you an important disclaimer that this is simply for educational purposes. And anything that I recommend, you should definitely speak with your cardiologist or family physician before starting any of these protocols. And if you have additional questions, please feel free to reach out to me, especially if you are on current prescription medications for cardiovascular issues, and that any of this information that I'm giving you today is not intended to diagnose. So today's topics, I'm going to talk about strokes. I'm going to talk about the different kinds of heart failure, and I'm going to give you some protocols that I like to use clinically for heart health. So I talk a lot about the Chinese 5 elements and this beautiful generating cycle that we have within Chinese medicine, that if you are living optimally, you should be experiencing this generating cycle pretty freely throughout the 24-hour clock every single day. That's water, wood, fire, earth, metal. Where disease happens is in these inner sort of star-like symbol we have here, where that we call that the controlling cycle. And this is where an element gets blocked and is not doing its job, and so therefore another element will control the element after it. So for instance, that might not make a whole lot of sense, but let me explain it. So when you experience edema, which is water retention, say in the feet, usually ankles, people see it, that is water controlling fire. So it's skipping that wood element of flow. So kidney blood and the bladder metabolism is over-attenuating. There's not enough fire to flush the water out and burn the water and evaporate it up. With endocrine issues like hyperthyroid and diabetes, this is a dysregulation within the wood element that usually causes wood insulting earth, right? Because diabetes is an earth element, and that's associated with our nutrition and phlegm and all of that kind of dampness in our body. So the wood becomes dysregulated and insults earth. Pulmonary edema, which is left-sided heart failure, is fire controlling the metal, which is heart controlling the lungs. So we have 4 chambers in our heart. We have the right side, which is deoxygenated blood, and the left side, which is oxygenated. And then we have an upper chamber, which receives blood, and our lower chamber pumps the blood away. And then there's cardiac regulation. So we have this SA node, which is our natural pacemaker in our body. And our nervous and endocrine systems influence our heart rate. So epinephrine, thyroxine increases our heart rate. And these are all things that we make naturally in our body. And then we have our autonomic nervous system, our ANS, which is our fight or flight, our parasympathetic rest and digest. We have the potassium, sodium, calcium, caffeine, drugs, and exercise training can all affect our cardiac regulation. So what exactly are strokes? And there are a couple different kinds. And this is an ischemic stroke, where a clot stops blood supply to an area of the brain. And this, in 2020, 1 in 6 deaths from cardiovascular disease was due to a stroke. And every 40 seconds, someone in the United States has a stroke, which means that every 3.5 minutes, someone dies of a stroke in the United States. Now, I obviously haven't updated this since 2020. I know that there are an increase of cardiovascular events happening. So I'd be curious to see where we are at right now, but this is where we were at in 2020. So about 87% of all strokes are ischemic strokes, in which blood flow to the brain is blocked. So stroke statistics by race and ethnicity. So stroke is the leading cause of death for Americans, but the risk of having a stroke varies with race and ethnicity. The risk of having a first stroke is nearly twice as high for Blacks as it is for whites, and Blacks have the highest rate of death due to stroke. So although stroke death rates have declined for decades among all race and ethnicities, Hispanics have also seen an increase in death rates since 2013. So why is that? There's a couple different factors. First one, socioeconomic. The next one is food access. We need access to healthy foods in order to be giving our body the fundamentals of what it needs right out of the gate in order to stay healthy. And that is organic foods, things that unfortunately might be out of people's reach, whether they're where they live geographically or just financially. And then the other thing is emotional stressors. So emotional issues, livelihoods, just those day-to-day things. Right now it's inflation for all of us, can lead to additional emotional stressors, which then affects our risk of stroke. So factors, of course, leading up to stroke and stroke death is high blood pressure, high cholesterol, smoking, obesity and diabetes. They are the leading cause of stroke. And 1 in 3 US adults has at least one of these conditions or habits, me included, for years. So know the signs. So when you are out in the world or you have family members and they are experiencing stroke-like symptoms, we use the FAST method. So here is face drooping, perfect example, left side face drooping. Arm weakness. So is one arm weak? Can you lift both of the arms? They will also experience speech difficulty, start slurring their speech. Can people understand their speech? And then time. So time is the brain. Go to the hospital immediately, call 911, preferably with an acute stroke unit. And I highly recommend, as you start taking care of aging parents or have anybody in your family who has diabetes, has been smoking for a long time, they're at higher risk, right? So if you want a pro tip, take a day and get certified in CPR, because you could save a life. Both you and the adult members of your household get certified. It's an easy training, and it's definitely can save a life of a family member if they are experiencing a stroke. So there are 4 types of heart failure. So heart failure is basically failure of the heart to pump adequately supply the blood to the body. Congestive heart failure is heart failure that results in a backup of blood and fluid in the lungs and body. So left-sided is the most common, and then there's right-sided, systolic, and diastolic. So left-sided heart failure, what are some of the symptoms? It leads to congestion in the lungs, fluid enters the alveoli, and which leads to pulmonary edema. And its symptoms include shortness of breath, coughing, low blood flow to areas of the body like the fingers and the toes. So in Chinese medicine, this is fire harassing metal. The heart is harassing the lungs, right? You can't breathe and your lungs are filling up with fluid and slowing down. Right-sided heart failure is where the right ventricle becomes enlarged due to back pressure from left-sided heart failure. So left-sided heart failure can lead to right-sided. Long-standing pulmonary hypertension, pulmonary disease. So right-sided pump failure is that backlog of blood, which congests all the major organs. And a lot of times people will experience fluid in the abdomen. And this is this picture that I'm showing you right now. They'll experience an enlarged liver, and they'll have swelling and edema in the lower extremities. Good way to test for this is to just do the poke test and see if their skin bounces back. So perfect, this is what we do here in clinic. Just push down, and if it stays here, clearly they are experiencing edema. So I have a 3-pack of supplements that I use. I have strokes and heart disease in my genetic line. And I found that doTERRA's Vitality Pack is a 3-pack of vitamins, and there is the super vitamin in here for anybody experiencing any sort of cardiovascular issues with its alpha CRS, which I will do a video on explaining all the herbs in it, because if you have cardiovascular issue, you're going to want to have all 3 of these vitamins working in tandem. So this is the Microplex multivitamin, which supports the metal element. It's got vitamin A, which helps prevent free radical to the arteries. There's calcium and magnesium in it, which is important for maintaining proper heart rhythm and blood pressure. Chromium, which helps raise the good HDL cholesterol. And then zinc, also very important, necessary for proper balance with copper for thiamine utilization. Vitamin E, which reduces blood clots, and vitamin B6 and B12, which maintains homeocysteine levels to reduce cholesterol and inflammation. So that's just in their multivitamin. And then you can't forget omegas and how important they are for cardiovascular health. So that supports the water element, right? We are talking about this controlling cycle of the water element, fire element, and metal element working together and insulting each other. So we want to support our water element. And I can't even pronounce this, astaxanthin, hopefully I said that correctly, provides powerful antioxidant and circulatory benefits, supports eye health, improves muscle strength and endurance, aids the liver and digestive system, supports skin health, and promotes healthy immune function. They have cold-pressed ahi seed oil, which provides a concentrated source of both ALA and SDA, which the body can convert more easily to EPA. ALA lowers the risk of fatal heart attacks by over 1/3, by the way, and it also contains additional vitamin A, D, and E just in this supplement. And then the last one, which I love in the tri-pack, is for cardiovascular health, specifically because in America, we have an abundance of people with cardiac problems simply because of the way we eat. That's like the root cause for sure. This supports our fire element. So some of the most important herbs in the supplement alone is grapeseed extract, which reduce clotting tendencies of the blood. Coenzyme, or CoQ10 we call it, streamlines metabolism and supports the adrenals, processes our fats, and removes toxins from the body. And then alpha lipoic acid, which is an antioxidant that lowers the bad cholesterol, the LDL. It has green tea in it, which is a powerful antioxidant to fight heart disease. Turmeric, which naturally lowers blood cholesterol, and ginkgo biloba, which strengthens the heart and stops chest pain. So you can get this at wholesale, this vitamin pack. It's 1 month of all of these herbs, wholesale for $80.50. If you are currently shopping and buying all of those herbs at the health food store just on their own, like I need grapeseed extract, I need alpha lipoic, I need green tea, I need this, and buying it all individually, stop what you're doing. You're spending money that you don't need to, because I can get it to you wholesale. So just reach out to me, let me know. So let's talk essential oils, because I love me some oils. So the first oil I want to encourage people to use is cypress. So cypress promotes proper circulation and blood flow throughout the body. Ylang ylang, which I love. It's one of my favorites. It balances your heart rate and reduces high blood pressure, and you will never wear toxic perfume again if you're a female, because it smells delicious. Marjoram supports the heart muscle, so eat more marjoram. 2 drops on the bottoms of the feet. This is how you can wear all of these. Again, like I said, ylang ylang, I wear it like a perfume. Black pepper warms and tones the blood vessels and decongests the circulatory lymphatic system. Geranium supports the heart blood and the blood vessel integrity. So again, like I said, 2 drops on the bottom of the feet. Now, if you are a woman who loves perfume, you can get ylang ylang and geranium together and simply put them right on the heart, rub them into your lymph here. Geranium is also really good for hormone balancing and detoxifying the lymph nodes. Or you can just wear it on the bottoms of the feet if it's too strong for you. But again, what clogs up our system and stops this process from flowing, right, is that blocked wood element, which means staying away from chemical perfumes, body lotions, and all of that stuff. It's root cause factor here. So herbs and food that you can eat to support your cardiovascular is alfalfa, borage seeds, horsetail mushrooms, and nettles, which are rich in minerals necessary for proper regulation of heart rhythm. Black cohosh is another one, oat straw, passion flower, valerian root, and skullcap. Skullcap is in the alpha CRS. So you are getting skullcap when you get the alpha CRS supplements. Eat some cayenne and ginger root. That strengthens the heart and it's helpful for chest pain as well. And then primrose, rosemary, and gutta cola can also subdue chest pain if you are prone to angina and those types of symptoms. Other important thing you can do is get enough fiber. Fiber helps us to eliminate toxins from our body, which supports the wood element from getting blocked, which creates a lot of this cycle too, and helps us detoxify. So make sure that you are getting fiber. Fiber also helps to get rid of all of that excess cholesterol and bile and all that guck that we need to get out of our bodies every rising when we wake up. So recommended daily fiber, women under 50, we need 25 to 28 grams of fiber per day. So why I love this fiber, it's got 12 grams of fiber per scoop. So and it tastes amazing too. It tastes like apple peels and apples. So I just put a scoop in hot water, stir it up, mix it up real good so it's nice and dissolved. And then I fill the rest of my pint glass with water. And, I put some wild orange oil in it or whatever and drink it down. I've got 12 grams of fiber. I haven't even started my day yet. So that gets you halfway to what you need. Men under 50, I already talked about women. You need 31 to 34 grams a day. So you need more fiber in your diet per day than a woman does. Women 51 and older, 22 grams per day. Men 51 and older needs 28 grams minimum per day. So let me know if you want to get some fiber at wholesale. To me, I feel like it tastes like having hot apple cider every single rising. That's the taste of it, essentially. Because fiber can taste pretty yucky, the kinds that you get. And I'm sorry, I don't want to rip on Metamucil, but that's full of sugar. A lot of it is. Okay, so after hearing all of this and you would like to see about getting some oils and starting a natural health protocol, especially if you suffer from cardiovascular disease, please reach out to me. Dr. Mika and I do a free tongue analysis for you based in Chinese medicines. We usually do them on Wednesday nights from 6:30 to 7:30-ish Pacific Standard Time. And we can look at your tongue and it lets us know what's going on with all of your organs. And then you can also interact with me at Rosemary and Thyme Oil Mavens. I have a Facebook group. If you're not on Facebook, I actually have a new Instagram at rosemarythyme.life is my handle. So thank you so much for joining me today and stay tuned for part 2.